I think that the challenge here in Florida is that 3.5 million Floridians are potentially eligible for benefits under the Affordable Care Act, who are either totally uninsured or underinsured. And we want to make sure that Floridians know what's coming, what opportunities they have, and can make good choices for themselves and their families. Clearly, this law is going to work more smoothly in states where you have full support from the governor and the legislature and providers and faith groups and others who want people to get information, want to make sure people know about the benefits. More challenging in states like Florida, where there is a lot of misinformation over and over and over again, and a lot of barriers to people finding ways that they can get good advice. Having said that, I'm really pleased. We had a great meeting today with a state representative, Rodriguez, who convened a group. We have members of the congressional delegation who are enthusiastic, engaged, and involved. We have mayors throughout the state of Florida who are using their outreach networks. I met with CEOs of hospitals. The community health centers will have education and outreach people. I was in Orlando on Friday with the head of CVS, the big pharmacy chain, who will have information and brochures in English and in Spanish in all of their pharmacy sites, as will Walgreens, as will Rite Aid. So I'm encouraged that in spite of some of the lack of official government support, there are a lot of very enthusiastic faith leaders, advocacy groups, healthcare providers who want to get information to people.
What about, for instance, the very example that you mentioned up there, stripping the insurance commissioner of the ability to review rates? That could possibly negatively affect Floridians who want to buy plans on the exchange. They may be more expensive, or at least one of the measures that was available to help, control those prices. Can you speak at all to that? I mean,
well, that's pretty unique in the country. No other state, except for Florida, has actually withdrawn their rate review authority, and they did it specifically for calendar years 2014 and 2015. It does seem that it's designed in a way that makes it more difficult to ensure that Florida consumers have the best possible prices in these new marketplaces. So the Florida Insurance Commissioner said, I'm not going to have anything to do with it. He knows well, because he's been president of the National Association of Insurance Commissioners, that the federal government does not review individual rates. We don't have that authority. We don't want that authority. These are Florida plans being sold in the Florida market to Florida consumers, and yet he's abdicated his responsibility to really make sure that they're the best rates at the best prices.
And also put out information saying that premiums are going to go up 30 to 40% or something along those lines. I mean, that's pretty scary stuff.
Well, and what we have, again, seen in other states in the country, when the insurance commissioner and the governor's office are very engaged and involved, the rates have been incredibly competitive. I mean, we have lots of new insurance companies coming into the marketplaces here in Florida and across the country. We have competition really does cause prices to go down, and transparency causes them even further. We have some rules in place, the so-called 80-20 rule, where insurance companies have to spend 80 cents of every health premium dollar on health benefits, not CEO salaries, not marketing plans. So there are some issues in place protecting consumers nationally, but having the state insurance commissioner not review rates at the state level for state programs won't serve Florida consumers very well.
You mentioned some specific figures about Miami-Dade, and you also mentioned that some additional Navigator funds may be available. I did hear a lot from local groups about, they even mentioned, for instance, the largest Navigator recipient, the University of South Florida. It's specified in their grant award that they're not to work in Miami-Dade, Broward, and Monroe, and this is what the USF told me as well. So it seems something that we're not fully understanding yet transpired. This is the first time I've heard that additional Navigator funds may be available. Can you explain why?
Actually, they're at this point, there are not additional Navigator funds for this year. We have requested additional funds in next year's budget. Whether or not Congress will actually pass a budget that has additional funds is really in the hands of the Congress. We had limited funds, no question about it. Very competitive grant applications that were kind of reviewed by a panel based on the outreach of the groups, what kind of network they already had in place. The University of South Florida, which had one of the major Navigator grants for Florida, actually has been engaged in enrollment and outreach around the children's insurance program for years. They have a lot of trained personnel who are very experienced in doing the kind of work we need to do. But there are also some specific entities here in South Florida, and we're just eager to work with them and want to make sure that people get the information. The community health centers, 100 of which are here. I mean, the community health centers in the Miami-Dade County will have about 100 trained enrollment and outreach people, culturally competent, language competent, and at a health entity where people are used to going for their health care, and that will be an additional resource on top of the Navigator grants.
What are the chances that Florida will approve Medicaid expansion efforts? You mentioned there are talks ongoing. I'm not privy to those talks, you may be, but could you?
Well, I think the Florida governor has indicated his endorsement of the plan. I met today with hospital CEOs, and they are very eager to continue this discussion. I know the business community, chambers of commerce in many Florida areas have looked at this return on investment and decided that having $53 billion in federal funds come into the state of Florida to pay for the coverage for uninsured Floridians would allow a great number of Florida resources to be spent on education and infrastructure and economic development that now is trying to pay for uncompensated care. So we're hoping that as the conversation continues, that legislators will reconsider the decision. There is no ending date. Florida can take up the Medicaid expansion at any point along the way. What does begin to click is the 100% federal funding is available for calendar years 2014, 2015, and 2016. So that every day that Florida doesn't take up the offer, those dollars are really left on the side of the road. And more importantly, millions of Floridians won't have any affordable health coverage.
I want to have an understanding of how you and the President and the administration would define success here. I mean, certainly I think that there are many uninsured that you referred to in the panel discussion. I would imagine one of the measures is to get many of those folks insured, as well as to control costs. Without expanding Medicaid, there are those folks that you spoke about as well in the gap who aren't going to be able to afford coverage, which kind of may frustrate those goals. But can you talk a little bit about that, about how we'll know success when we see it, because this is kind of an experiment?
Well, the Congressional Budget Office actually projected that 7 million eligible individuals across the country would sign up in the first open enrollment period. So that has been kind of a target that we have taken very seriously. We have a great cost story to tell already. In the 3.5 years since the Affordable Care Act was passed, we are seeing some of the lowest healthcare cost increases in well over 50 years. Medicare rates have increased at the lowest level ever in the history of the program, while those beneficiaries actually have more benefits with the Affordable Care Act. We have seen Medicaid rates, more people involved in Medicaid, but Medicaid rates actually across the country went down last year. So again, a very good cost story to tell. And private insurance market rates and private underlying healthcare costs are rising at the slowest level that they have in decades. So the cost story is actually very, very positive. And some of it is about changing the way people get care, but also putting some incentives for people to get preventive services, get checkups, find things early, get it taken care of, fill your prescription drugs and follow the doctor's orders so that you don't end up back in the hospital. That's all going to be much more possible with insurance, more affordable and available for lots of folks.
Okay. Well, thank you. I really
Sure.
appreciate you taking the time.
Yeah.
Thanks so
Nice to
much.
see you.
Nice to see you too.